Thank you for joining us for this free webinar, Compliments of Downtown Women OBGYN. We at Downtown Women are committed to your maternal well-being, not just how you are doing physically, but also how you are coping emotionally, especially during such a challenging time. My name is Gulzar Selby Nakshina. I'm a licensed psychoanalyst and the director of the Prenatal and Postpartum Support Program here at Downtown Women. With me today is Dr. Suzanne Lajoie, Senior Obstetrician at Downtown Women. She will be answering all your medical questions related to COVID-19 and the perinatal period. Before we start, I want to introduce you to the Prenatal and Postpartum Support Program. We are here for you throughout the course of your pregnancy and your first year postpartum. Whether you're feeling anxious, overwhelmed, or you're not sure how you're feeling, we're here to support you in a variety of ways. Before we start, I want to let you know about two groups we've actively added this week. One is a pregnancy support group and the other is a postpartum support group. These groups are virtual over Zoom. We keep them very affordable and they're available to all of you. Please email me directly to sign up since space is limited. Right now, I'm also offering virtual therapy sessions over Zoom if you need individual sessions, or you can contact me for referrals. I know a lot of practitioners who are accommodating patients over Zoom, and many are working on a sliding scale to support people in this critical time. You ladies are incredibly important to us at Downtown Women. We take pride in our comprehensive approach to helping you through your transition into motherhood, not only physically, but also mentally and emotionally. Last note before we begin, we did create a feedback form to help us understand how to better serve you in this time. Please fill out that form after the webinar. The more you tell us about what you need in this time, the more we can do to help support you. Perry's email will be available on your screen during the webinar, and you can email her if you have any additional questions or need the feedback form. Most of you should know my associate Perry. If she hasn't called you already yet, she will call you sometimes during your pregnancy or postpartum to check up on you. My email is here on your screen now. You can always reach out to me for a session, individual, or to join one of our groups. Great. And I do want to say, somebody just asked if this is being recorded. It is being recorded. Unfortunately, I forgot to press record when we started. So the beginning of it will not be recorded, but I will touch on that all at the very end just to include it.
So Gulzar, someone just asked about the type of blood pressure cuff to purchase. I don't have a specific recommendation. I would not spend a lot of money on it. Somewhere between $20 to $30 to be sufficient.
Okay, great. So I am going to turn off the chats for now.
Okay.
They're only going to Perry. So Perry is going to keep all the chats just because I want to keep us on our very tight schedule to get these answered.
Okay.
But thank you, whoever asked about the recording, because you really saved me right now. Okay. So is it safe to go to my sonograms, 3D ultrasounds, etc. at NYU? Is there a safer facility?
No. So you should absolutely keep your sonogram appointment. Most people will have only one sonogram at any week mark. And realize that you're not going to the hospital. You're not going to Tisch Hospital. You're going to an ambulatory center, which is somewhere around Park Avenue and 33rd Street. So it's very safe. You should keep that appointment.
Great. Should I buy a Doptone to monitor my pregnancy?
Yeah, I would say no. I don't think it's necessary. I think the amount of prenatal care that we're doing in the office is sufficient to monitor your baby. I always worry about patients not hearing a heartbeat, not knowing how to use it, and then panicking. And we've got enough stress right now with the pandemic going on. I don't think that that's really necessary.
Great. We don't want to add any more unnecessary anxiety. So I'll keep that in mind. This is a hard enough time as it is. What is Downtown Women's policy on in-office versus televisits? And this also applies to our GYN patients.
Yeah, so our GYN annual patients, we are postponing for now. We are postponing them until this is all over. So I would say probably to call back in May if for some reason you're watching this and you're a GYN patient. Otherwise, we're doing televisits for anything that is urgent. We're not doing a lot of contraceptive management. We are doing phone consultations. And like I said, we're doing some prenatal telephone consultations as well. We're also fielding a lot of telephone visits, and a lot of the doctors are fielding those from home because some of us are working at home, but we'll get to that later.
Great. Should I worry about the doctors and nurses at Downtown Women getting COVID?
We all worry about it. It's very anxiety provoking. We have put a few measures in place to prevent that from happening. So as I alluded to before, we have half of the obstetricians working in the office and half working from home. This way we're trying to limit exposure by keeping half of the staff at home. People who are staying home are really still chipping in by doing all the telephone consults and phone calls and administrative stuff. So we're trying to keep half of our staff healthy and away from people as much as we can. The obstetricians at Downtown Women have actually changed our call schedule so that we're only taking call in 12-hour shifts instead of 24-hour shifts, again, to decrease the amount of exposure in the hospital. We've also secured a private call room, which is very envious, so that we're not sharing call rooms with other doctors.
Great. So a lot of precautions are being taken.
Lots. We're disinfecting the office like crazy. We're washing hands like crazy. Nobody's washing their hands. Everyone's wearing masks. We're being as cautious as possible.
Great. What protective measures should I take during my doctor's appointments at Downtown Women and Langone? Should I bring a mask?
Yeah, so I'm all for masks now that the CDC came out yesterday and said everyone should wear a mask. So yeah, wear a mask. And just to touch on labor and delivery, and I know we'll get to that later, goals are, is if you have a mask, please bring it to the hospital with you. I think the healthcare workers that will be interacting with you would really appreciate that. We don't have enough PPE to offer to the patients, but if you certainly have a mask, please bring it on that day.
Great. I know that that's constantly changing, so patients have been really curious about what to listen to, but it's really about the most recent information that's come out. And so we're going to be getting a lot of information. It's going to be changing rapidly, which is part of the reason we're doing this webinar.
Right.
So what is the safest way to travel to my appointments or the hospital?
Yeah, so I think the safest way is in a private car. I think the least safe way is by public transportation. And somewhere in the middle is a car or an Uber or a taxi. Not everyone is having a car these days. A lot of us are New Yorkers and live with a Metro card. So if you're going to take an Uber, I would say maybe wipe it down with some Clorox wipes. You know, try not to touch anything. It's hard not to touch things. You should put your seatbelt on. But I would try to wipe down as many surfaces as possible. Wear your mask. Do not touch your face.
Great. And what about walking or taking a bike? So some of our patients are pretty far along.
Yeah, I mean, I think walking in pregnancy is fine. Should you walk from Brooklyn to Manhattan? I mean, hey, if you're in great shape, that's one thing. I wouldn't want anyone to really put themselves out by walking a very long distance. And I think bike riding is safe in the first trimester. I think after that, your balance is probably off. So I wouldn't recommend that after about 13 weeks or so. And if you're bike riding, you should always, always, always wear your helmet.
Great. Should we expect changes to Downtown Women's policies and suggestions as the pandemic peaks? We kind of touched that.
Yeah, I mean, everything's kind of changing really rapidly. I mean, I think the biggest change is the masks. I mean, we weren't wearing masks. If you had asked me 2 weeks ago, I don't think anyone in our office was really wearing masks, and that's something that has changed. Sorry, I'm touching my face, which I shouldn't be. So yeah, I mean, I think the masks are a really good example of that, how things are constantly changing. We've certainly changed our disinfecting, procedure in the office. We've got hand sanitizer all over the place, and things are obviously changing in the hospital as well, with the PPE gear that we've been given to wear. So, we can get to that during labor and delivery, but things are going to look a little bit different in the hospital.
If I leave New York City and do temporary care elsewhere, will Downtown Women still take me back as a patient?
Absolutely. We want to take really good care of our patients. We understand if you have the ability to get out of New York City temporarily, and we will absolutely take you back as one of our patients. So do not add that to anything that you need to be anxious about.
Good. What if I do get conflicting information from multiple providers?
Yeah, I mean, that's a good question. And I think that does sometimes happen. I would like to think that if it's happening now, it's because we're getting a lot of conflicting information. And I think, you know, things are changing so rapidly. What I believe last week is probably going to be different from next week. So I'm just going to answer one more thing, Golzar, because someone's saying about an ambulance, and I know I shouldn't be looking at the chat.
Don't look at that. Perry is going to send the messages to me.
Okay.
You can answer this one.
It was just about taking an ambulance to the hospital. I would really, really, really discourage you from taking an ambulance to the hospital. The ambulances are really busy. They're being used by very sick people. I don't think it's a good place for you to be. I don't think you ever need to take an ambulance to the hospital unless there's a dire emergency, and that very, very rarely happens. So please take a car or walk, or don't take your bike because you're going to be very pregnant, but don't take an ambulance. Don't call 911 unless it's a true emergency.
Okay, so we will touch on some of this later. We will talk about ambulance and what happens in an emergency situation later. For those of you who are just logging on, I want to remind you that or let you know that we will have a feedback form which will allow for other questions that comes to you after this webinar. We are intending, if this goes well and if we get positive responses from it, to do more webinars and be able to answer additional questions. We might not have time for a Q&A today because we have so much information to cover, but we are intending to keep answering your questions and be in touch and maybe do a actual Q&A next week. I do want to ask you, Dr. Lajoie, since we didn't get it on the recording, my mistake, can you tell me again how, what appointments patients are going to, what's the impact of missing appointments?
Yeah. Let's go through that again. That's a good question. So I'm encouraging everyone to keep their appointments. We have changed the schedule in a way that we think is safe to monitor your pregnancy. So we're having first visits at about 10 weeks where we do an ultrasound and we do blood work. Second visit at about 13 weeks where we do something called the nuchal translucency. It's a test for chromosomal abnormalities. There's a sonogram that's done at 20 weeks, and in between those two visits, we're doing a telephone visit. And again, let's just stop here and talk about the importance of having a blood pressure cuff and having a scale. So if you're early in your pregnancy, that's something that you should invest in and have, because when we call you for your telephone visits, we're going to ask those questions. Again, a telephone visit at 24 weeks, at 28 weeks, a visit for glucose testing and for a red blood cell count monitoring, and the RhoGAM injection if you're Rh negative. So don't worry about getting your RhoGAM, guys. We have it in the office and we'll get it to you. We're seeing you guys at about 30 to 31 weeks, and you'll get your Tdap shot then. Someone just chatted that. Sorry, Gofar.
I'm gonna turn them off.
I dare you.
You guys know Dr. Lajoie. You know she can't handle all these distractions. Come on.
Okay, so Tdap shot, and then telephone visit at about 33 weeks, and then at 36 weeks weekly. So that's our new schedule, and it's safe to monitor your babies and to monitor you. So I would encourage you to keep all of your visits.
Good. And then I'm not sure if I made it on the recording, but do not buy a Daptone. They will only make you more anxious. Don't
buy a Daptone, guys. We got it. We know how to use them.
Okay. So now we're moving on to COVID and pregnancy.
Okay.
So are pregnant women considered immunocompromised and at greater risk for COVID-19?
Yeah, so this is a great question. And I think when it first came out, we kind of compared it to the flu because it's the only thing that is kind of similar in terms of being infectious like this. So flu, we know in pregnant women can be more dangerous, leading to pneumonia, and that there is an immunocompromised system, and that has not changed. But it doesn't look like COVID-19 is acting like the flu, and we don't think pregnant women are more susceptible to it. They're acting like non-pregnant women, which is great news.
Great. So is pregnancy a reason to be tested regardless of symptom severity? Which of the medications are safe to take while pregnant?
Yeah, so you should not be getting tested for COVID-19 just because you're pregnant. If you have symptoms, if you have fever, cough, body aches, I would say reach out to your primary care doctor. Most diagnosis of COVID is just clinically with symptoms and talking to a primary care doctor. We still don't have access to testing. We don't have testing in our office. Some people have asked me that before, but being pregnant alone is not a reason to have a COVID test.
Good. And how does COVID-19 affect pregnancy, a fetus, or a newborn?
So we think that there is no vertical transmission, meaning that we don't think that the mom passes it to their newborn. There are very, very rare cases where some people have said that it does not affect newborns and children. I do know that there was recently a 6-week-old newborn who unfortunately died, and it was related to COVID-19. I actually saw one of the pediatricians in the hospital, and she kind of said what I was kind of suspecting is, was there something else underlying in that baby? Obviously, if this was something that affected newborns and children, we would have seen it by now. And so I don't think that that's something that is worrisome in terms of vertical transmission.
Great. So we think that there was probably something else adding to the COVID.
Yeah, I mean, we don't know for sure, but it's suspicious. It sounds like there was something else going on.
Okay, that's helpful. Are pregnant women given any priority for COVID testing at NYU or anywhere else?
Say that one more time, Gulzar.
Are pregnant women given any priority for COVID testing at NYU or anywhere else?
Yeah, so I think the general answer is no, that if you're pregnant, no, there is no priority. However, let's start to talk about the hospital a little bit, if that's okay, Gulzar. If you come to the hospital.
We're getting into that next.
Okay, perfect. So if you're in labor, when you get in touch with one of us and we call you back, if you are having symptoms of COVID, please tell us right away. If you have a cough, if you're not feeling well, if you have fever, please tell us at that initial phone call so that we know to give a heads up to labor and delivery. If you come in and you have, if we're suspicious that you have COVID-19, you're going to get a test right away. Okay, so that's when you'll have priority to have a test if you're sick. Hopefully no one will need that prioritization.
Great. Would you advise a patient to find a doctor or make a contingency labor and delivery plan in a city or state outside of New York? And this is a really important one for us to talk about.
So I just want to plug NYU a little bit. I really think they're a world-renowned hospital. I think we've won many, many, many awards. It's a baby-friendly hospital, meaning that mom and baby are one unit. Our goal is to deliver the baby onto the maternal abdomen and keep you guys there together as you're in labor and delivery and as you go to the mother-baby floor. I think most of our patients come to us because they trust our medical expertise. Mm-hmm. You know, we really are committed to giving women individual birth plans and birth expectations, and everyone's birth is important to us and special to us. So we would encourage you to stay with us. Most people have their support system here. I think NYU is on top of this COVID-19 pandemic like no one else. Their ICU staff is amazing. Their ER staff is amazing. I had my baby at NYU, my babies. When my son had an emergency and I live in Brooklyn, I went all the way to NYU to take him there. I mean, I trust them with my family. I trust them with my patients. The people that work there feel like family to me. And I think if you left, I don't know that you would get the same quality of care or the same experience that you would with Downtown Women at NYU.
Yeah, and wasn't the ER head of NYU just interviewed on PBS a few days ago?
I believe that is true, Gulzar.
So it's a pretty important hospital then, right?
It's a very prestigious hospital. I love it there. I think our patients have really, really good experiences there. The nursing staff is amazing.
There are also a lot of other issues, like some doctors out in states outside of New York are not taking patients.
Yeah.
They want a 14-day quarantine for any New York City patients who move to another state. And there has been some, correct me if I'm wrong, some doctor's offices that were denying patients access to medical care.
Yeah, I mean, if you're going to change to a different facility, I would make sure you're not going to be on a 14-day quarantine, which is, we are in the hub of this. I have heard about that happening. There are practices who are not taking more patients. So I think if you really made this decision and committed to delivering somewhere else, do your research. Make sure that you have someone who has your back and is going to take really good care of you like we would. Great.
What if I'm living outside of the city but want to deliver at NYU?
Yeah, absolutely. So patients who have gone away temporarily and come back, we'll take them. We're always open to having new patients. And this has happened where patients who are not our patients called in the middle of their pregnancy and wanted to transfer in, and we've been doing it. We want this to be not stressful. We want to take away the stress if we can. So yeah, we're open to taking new patients.
Great. How is increased anxiety during this time likely to affect the baby?
I don't know, Gulzar, maybe I should ask you. I think that, you know, I did a delivery, was it 2 days ago? And when the baby came out, I just got teary because it's just like, no matter war, famine, pandemic, Hurricane Sandy, I feel like I'm getting teary. Like there's always birth and it's always there. And it just plugs through every disaster that comes through, the babies come through. So do I think anxiety in pregnancy is a good thing? No. Do I think it affects newborns? I don't know, Gulzar. I mean, there's probably a million studies that go through this, but I think we're really committed in my practice to having the mom and the baby delivered safely. But maybe you want to speak a little bit about anxiety in pregnancy. I know there's increased anxiety during pregnancy, and now with this, it's an unfortunate time to be pregnant, and it's really stressful.
Yeah, I mean, listen, there are a lot of studies that suggest that increased anxiety in the mother does impact the emotional state of the child, that like in the future, the baby might become a more anxious child. Now, you know, I think it's a little more complicated than being that cut and dry. And the reality is that there are things throughout history and right now that are going to make people anxious during their pregnancy. People have always given birth during war. And in our lifetimes, there have been plenty of wars that people have been delivering through and that children have been healthy and well-adjusted regardless. Yes, we want to minimize your anxiety. And that is why we have so many things in place at Downtown Women to help you monitor your anxiety and to help minimize it. That's why we have the groups. That's why we have this webinar. That's why we have me, an in-house therapist, and I give you tons of referrals. So we do want to help you minimize the anxiety. Pregnancy is already an anxious time, and this is definitely increasing that. But does it mean that it's going to have some catastrophic impact on the child? No, because people have always had babies, and you probably know somebody who was born during into a war zone, like Lebanon or Croatia, or, you know, so you probably know somebody and they're fine and they're well adjusted, but we do want to minimize your anxiety because we also want to keep your blood pressure down.
Yes.
So if you are feeling really anxious, if it does feel out of control, I'm going to go over the perinatal program at the end of this again, since I forgot to record the beginning, but please reach out to me or Perry. Perry's email is available right there on your screen. It's pthompson@downtownwomen.com. And one of us will definitely make sure that you are getting the support and the care that you need at this time. So given cancellation of in-person events, how can I prepare for childbirth and infant care?
Yeah, I think everything has started to go remotely. There are plenty of remote childbirth classes that are happening that you can plug into. Ready, Set, Baby, which is an NYU program to prep you for being a patient on the mother baby unit, has gone online. That's a great resource. I would encourage everyone to take that. And then doulaing has become virtual doulaing, which is kind of interesting and fun. But already we've had some people who have labored at home with a doula on FaceTime. So I think it's great. I think you're kind of like rolling with the punches here to have some good labor support going on.
Yeah, and at Downtown Women, we have a list of all the different virtual support. So really reach out to us if you need something. All of that kind of care can be done virtually over over FaceTime.
Yeah, one of our midwives is doing it as well, Emery.
Yes, Emery Ship.
Yeah, and her name is on your list.
Yes, and we recommend her because she's wonderful and really fun.
Yeah, she's a good egg.
Actually, the reason the prenatal postpartum support program started at Downtown Women, I have to say special thank you to Dr. Lachua, who is an amazing, she's on that side of my screen. I don't know, she might be on that side for you guys. I'm not really sure. But Dr. Lachua and Emery Ship are the two people who really fought for this kind of program in our practice. And so both of them are wonderful.
And I think we're one of the only practices that have this. And I think it's so great for our patients. So great for our patients, Gulzar. We're so grateful for you too.
Thank you. Okay, so now let's move to giving birth during COVID and NYU. We touched on some of these, but we might go a little more in depth. So how has the labor and delivery process at NYU changed in response to COVID? What can I expect upon entering the hospital?
Okay, so let's start with your partner. So you are allowed one partner. Partners can't be swapped out. So pick your person, and your person cannot be sick. I can't emphasize this enough. If your person is sick, that's that. Okay, so I would encourage you to have a backup person. It sounds like this disease comes on kind of rapidly. People are fine and then suddenly they're not fine. And just to decrease anxiety, it's probably good to have a backup person. When you go to labor and delivery, and I'm going to remember to tell everyone to go to 560 First Avenue at this point, Gulzar. So there are two entrances to the hospital. There's an entrance at the Kimmel Pavilion, which is on 34th Street. It has a big statue of a dog with a taxi on its nose, and I know that's really cool, but don't go through that entrance. Go through 560 First Avenue. It's way more chill. Everybody
get a pen and paper right now and write this down because this is critical. Go ahead, Dr. Lachua.
Yes.
Give them the address again.
560 First Avenue. It's on First Avenue, approximately 32nd Street. It's like a separate entrance for labor and delivery people. And it's away from the COVID-19 crowd. On 34th Street, there's a lot of ambulances. There's a lot of scurrying. There's a lot of people. So I wouldn't go in through that way. Let's keep things calm. Go in through 560 First Avenue. Security guards are there. They'll tell you where to go if you don't know where to go. When you come in, there will be an employee entrance and a visitor's entrance. Obviously, you're going to go through the visitor's entrance. So 550, 560, guys, it doesn't matter. So I am still looking at the chat, Cova. It's a big building. So if you're getting in an Uber, you could tell them 550 or 560. It's a hospital. It's a big place.
I'm going to call your kid and have your kid put a Post-it on the part of your screen that is showing those chats.
Yeah, they could give a hoot what I'm doing in here. So you will get to a part where the security guards will be there and they'll be screening. So they're going to screen you and your visitor. Obviously, you're going to pass through, but they are going to ask your visitor about symptoms of COVID. We're not checking for fevers there as far as I can tell, but if they look febrile or sick, they're going to stop you there. So once you get to labor and delivery, everything's kind of status quo. I mean, everything is the same. We're in a separate part of the hospital. We're our own independent unit. We have a whole floor of the hospital to ourselves. There are no COVID patients there. There are pregnant COVID, I guess I should correct myself. COVID patients are there. But if they need a cesarean section, they're actually done in the Kimmel Pavilion in a separate part of the hospital. I think the biggest thing that you're gonna notice when you get there is everyone has a lot of protective gear on, like what you see on TV with like the face shields and the booties and the gloves. And, we were wearing probably 2 masks each. When I did that delivery this week or last week, I just gave her heads up. I'm like, when we come in to deliver you, we're gonna have some extra gear on. So it's not, it looks like, not monstrous, but it looks like someone with a lot of gear on. So you should anticipate us kind of looking a little funny and very well protected.
But that's also for your protection, because the better protected the doctors are, the better protected you are.
Absolutely.
So. And then just so everybody knows, we are going to tell the doctors who you call when you go into labor to give you that address. So even if you didn't write it down right now, or if you're afraid you're going to forget, don't worry. You will be reminded that when you are instructed to go to the hospital. Is that right, Dr. Lajoie?
That is correct, Gulzar.
Okay, good. So can we talk a little bit about other precautions that are being taken by NYU?
We can, in terms of what?
I don't know. Anything else that comes to mind?
In terms of having, well, I think the first thing that we should talk about is that all the COVID-19 patients are in a separate hospital. They're all in the Kimmel, that new big hospital that was built. Thank God it was built, because it's obviously has a lot of beds in it. So all the COVID patients are there. Very few of them are in Tisch Hospital, which is where labor and delivery is. So in terms of being exposed to COVID-19, obviously we're really trying to minimize the risk of either patients contracting it or us contracting it. So that's one of the systems in place.
Great. And if you didn't get the address, you can always ask, email Perry and get it from her, or talk to the doctors when you call to go to the hospital. So you don't have to worry about that right now. What is the current—
My dad's trying to FaceTime me, Gulzar. Should I answer?
Does everyone want to meet her dad? I think so.
Okay, he is just the best timing.
Does he have any thoughts on all of this?
He's just worried about me. He's my daddy.
That's sweet. So what is the current birth partner policy at NYU Langone? Despite the recent executive order, is there a scenario where this changes?
No, I think after the governor put his foot down, which we're glad he did, NYU always had a partner, encouraged a partner to come. So we were never a hospital that said women had to labor alone. So that's not going to change. I don't think the number will go up, like you'll be allowed to have multiple people, but one person, I feel confident that that will be the policy going forward.
Great. And it was always ACOG's recommendation, correct me if I'm wrong, that one partner policy was allowed, and we were following that recommendation from ACOG.
That's right. That's right.
Do you want to tell them what ACOG is, just so they know?
American College of Obstetrics and Gynecologists.
So it's who the OBGYN practices look to for guidance, right?
Yeah, it's kind of like a national, not club, but, you know, entity that we all look to for guidelines and protocols.
And so we were following them the whole time, which was allowing a partner.
Yes, yes.
What happens if I test positive for COVID-19 while delivering?
So all of the labor and delivery rooms are separate. We will make sure that you're in a separate one. If you do test positive, we will separate you from your newborn. So that is true. I know a lot of people have asked about that. In terms of what happens after that, I'm really not sure, and I don't want to give any misinformation. It has not, knocking on wood, happened to any of our patients so far, but there will be separation if you do test positive in labor and delivery.
And that is for the safety of the baby.
That's right.
Okay, so Dr. Lajoie, can you tell me what you think about this statement? Was that good enough? Dr. Lajoie wanted me to sound like Anderson Cooper when I asked that. I don't think I did.
Gupta.
Okay. Delivering in a system that has provided you with all your prenatal care and knows you is more optimal. We now have probably the best firsthand information about COVID and how obstetric patients are responding to this virus. And quite honestly, other centers in the United States are looking to us to give guidance on what we are doing.
Yeah, I love that statement, Gulzar. And I think, did we talk about home births yet? But I think that statement—
That we should right now.
Yeah, I think that statement just is exactly how I feel about home births. You know, I think delivering in a hospital, delivering with physicians that know you, delivering in a place where there are emergency protocols in place to keep the mother and the baby safe are ideal. And I can tell you at NYU, there are layers of safety that are built into the system for the mother and the baby. I would discourage a home birth at this point. I don't think that that's a good option during this pandemic.
And can we talk a little bit about what would happen if a home birth went wrong? Like,
yeah. So let's first say, and I don't know the situation with the midwives that are going on. I'm sure their demand is going up. I have no idea about their personal protective equipment. I don't know what they have, what kind of protocols they have in place. I think this is where an ambulance might be used, right? So if there's a dire emergency and you need to get to a hospital quickly and you've decided to have a home birth, I mean, I don't know if you've ever dialed 911. It takes a minute. I mean, I don't know that there isn't instant access to an ambulance. The ambulances are always, they're also being stretched. Their capacity is really being stretched. So that is a less than ideal way to have your baby. You know, most home births go fine. I think it's the opinion of all the physicians at Downtown Women that it's safer to have a hospital birth.
Yeah, I think it's really important to stick to your plan, stick to the providers that you know and you trust, and so that you can feel safe and comforted during your delivery, because delivering in a completely foreign place or with a plan you didn't have or with people you don't know is going to be a lot harder than sticking with the people that you chose because you trust us. Will my baby be safe at NYU?
Yes, because your baby will be with you and you're going to be safe too. So yeah, like I said, it's a baby-friendly hospital. So the two of you are not separated unless there's something wrong. Obviously, I always say safety first. So from the time the baby is born and the baby's placed on your abdomen, you guys move through the hospital as one unit, okay? So the two of you will be together. As you go to the mother-baby unit, you'll have one nurse. The one nurse comes down to the labor and delivery floor, admits the baby, and you guys are one unit. When you go upstairs, you have one nurse for both the baby and you will not be separated unless there's a medical reason to do so.
And I just want to clarify that we are taking plenty of precautions to make sure that our doctors are safe and are staying healthy. We have changed the call schedule. We've made a lot of changes in the way that we function as a practice to make sure that the doctors are safe so that they can continue to care for all of you. Is there a scenario where I do not give birth at the NYU hospital? So there were a lot of questions about, like, are we going to have to deliver in other places if this pandemic gets worse?
Yeah, I can't see that happening, Gulzar. I feel like labor and delivery is really secure. The type of medicine that we practice is very specific. It's not something that other nurses or generalists or, you know, that they can practice. I don't think there's a risk of COVID beds being taken over or labor and delivery going away and those patient beds being open to COVID patients. That's not something that's going to happen. Nothing that I can see in the foreseeable future, at least.
And that's also because there's a lot of equipment and things that are necessary for labor and delivery and for the babies postpartum that can't really be moved, right?
Right. We are our own separate entity. We have operating rooms, we have labor and delivery rooms, we have places for the baby to be born, we have places for people to recover post-op. I mean, it's a very specific setup that would not even accommodate COVID-19 patients.
And it is essential.
I think so.
You know, there are a lot of different medical practices that are not that have shut down for the time being, but that is not going to happen to labor and delivery.
No one's going to deliver at the Javits Center. No one's going to deliver in the middle of Central Park or on the Comfort. You know, you guys will be delivered at NYU in a safe manner. Great.
Given the current demands on doctors, will I be rushed through my labor or given an unnecessary C-section?
No, you guys will be COVID. We treat everybody the same. You will not be rushed. There's nobody who's having an automatic cesarean section. All the C-sections are being done for routine obstetrical reasons, and COVID-19 is not one of them. And no one is going to rush you through your labor.
Somebody wanted to know if they should give up hope for their VBAC.
No, COVID-19 does not prevent VBACing. So that policy won't change next week.
Good. So you guys are functioning pretty much the same way in terms
Everything
of how
is the same. The nurses are the same. The doctors are the same. The postpartum nurses, the nursery, the NICU, the anesthesiologists, all the faces are the same. Nothing has changed. And we really do, I like to say we really, really work well as a team. And we do feel like a family in some ways.
Good. Is there a possibility that I won't be able to have an epidural?
No. On demand. If you want an epidural, you'll have one. Sometimes there's a wait if the anesthesiologists are in the middle of a C-section or if another patient needs an epidural, but there's no shortage of epidurals on labor and delivery from COVID-19.
Great. With the current COVID-19 situation, is Downtown Women recommending that laboring parents stay home as long as possible so they spend less time at the hospital?
I mean, we always encourage people to stay home as long as possible, but I don't think you should stay home longer than your comfort zone. If you're feeling like you need to come to the hospital, please come. Don't stay home so long that you either can't get to the hospital, you're delivering at home. I don't think anything has changed in terms of our recommendations in terms of when to come to the hospital. So
Great.
Come when you're ready.
And somebody wanted to know if circumcisions are happening as normal. Okay.
Yes, they are.
What is virtual support from a doula, and should I consider it? We've talked about this a little, but let's go into a little more depth.
So virtual support from a doula is kind of what we're doing now. You have a Zoom session while you're in labor or you FaceTime. And obviously they can't touch you or massage you or give you some essential oil, but they could certainly have suggestions. And in terms of staying home longer, if that's something that is in your birth plan, that's a great tool to have.
Great. So let's move on to COVID and the postpartum period.
Okay.
Will my hospital stay be rushed, or should I plan on getting out of the hospital as quickly as possible?
Yeah, great question, Gulzar.
So, oh my God, I'm so sorry. Of course, all the online shopping I did all week is being delivered right now in the middle of the webinar, and I have the loudest buzzer. I know everybody went online shopping for silk pajamas this week, and it wasn't just me. Did you? I guess you're working, so you don't.
Okay, so where were we? Yes, so postpartum. So we are sending patients home. We do not like to use the word rushed. No one is getting rushed out of the hospital. C-sections used to go home post-op day 3. Now they're going home post-op day 2. And postpartum patients used to go home postpartum day 2. Now we're sending them home postpartum day 1. However, we are not sending home anyone who feels uncomfortable going home. So no one should feel rushed. The one thing that I would recommend is once you deliver to really tap into your lactation consultants. I think that's sometimes the biggest factor that I consider when sending someone home, because breastfeeding, it can be challenging in the beginning. And when you're home and you're home alone, it's going to be you and that baby. So when you come to the hospital, since you will be there for a shorter amount of time, I would really, get into the lactation consultants, and all the nurses are lactation counselors. So there's still a lot of breastfeeding support. They're not doing a group breastfeeding class anymore, so they're doing it all individualized.
Right. Will my partner be able to stay the night at the hospital?
Yes. Just remember, it's one person and you cannot swap them out. You can't have your partner with you for labor and then have someone different. But yes, your partner can stay with you overnight.
Great. Can I go to another state to live with my parents or in-laws postpartum to get out of New York and have support?
Yeah, so Gulzar, I think this is when we started talking about the importance of postpartum support. Mm-hmm. And I don't know that we say this all the time to our patients, but the postpartum period can really be the most challenging part. You've got a newborn, you're unsure and insecure, and the boobs are dripping and your vagina doesn't feel fantastic, and there's just a lot going on.
And you're not sleeping and you're not eating. And
you're not, right, you're not sleeping.
And you haven't been outside
eating.
In weeks.
Yeah, so I think that you should go where the most support is. I mean, if you are New York based, probably that's here. People can drop things off to you. You shouldn't feel like you're in total isolation, although you are not seeing people. But if you need laundry done or food, and I always felt like when I was postpartum, I needed food, someone to clean my house, and laundry. Those were my top priorities. But certainly if you feel like you're gonna get more support outside of New York City with a family member, then I'm all for that. I mean, I do think that there is something to be said for getting fresh air and for kind of seeing the sunshine. And so I think that you should make that happen, however it's gonna happen.
And I do think it's really important to talk about how you're getting somewhere else, and are you getting there safely? So
Yeah.
getting on a plane postpartum with a newborn, we don't recommend. Can you drive there? Do you have a car you own that is clean that you can drive there in? Or are you going to clean the car? Is somebody going to clean a car before you rent one? How are you going to get there? How long is the drive? Are you going to have to stay the night a few places along the way? So there are a lot of things to consider if you are planning on leaving town. I do love the idea of you being with grandparents who can take care of you and who can make sure that you're eating and give you breaks for sleeping, and a backyard you can go into, since most of us don't have that here in New York. But there are a few other considerations. One is how you get there, and two is, are your parents or your in-laws elderly? Are they at risk? Are you going to be putting them at risk on your commute to them? And that's not going to make postpartum any easier if they get sick. So those are also things to really keep in mind. I think it's a very individualized approach, but also remember that that is why Perry and I are here at Downtown Women. We're here to make sure that your postpartum period goes as smoothly as possible. So we'll be talking to you throughout. You can always reach out to us and we can talk to you about what you can do to eat better, to sleep better, to take care of yourself better so that you do feel more stable, and how your partner can pitch in. And then if you need additional help, as I said before, we have groups for you to join postpartum, and there's tons of accessible individual therapy, especially right now, because a lot of practitioners are going sliding scale to support people in this time. So before you just pick up and run, really think through the decision and what the risks are en route and what the gain is whenever you get there. And maybe there's something we can do or help you, a plan we can help you make before you need to do such a drastic plan if it's not very safe. Do you have anything to add, Dr. Lajoie?
No, I think that sounds perfect.
My family has been self-quarantining in preparation to meet the baby. Can they visit postpartum in my home? Grandparents specifically.
Yeah, I would advise against having anyone around you. I mean anyone. I mean grandparents, nieces, aunties, whoever. And I don't think self-quarantine precludes that. So I would really keep the rule of social distancing as much as possible in the postpartum period, regardless of who it is. And I would stick to virtual things so that they can meet your baby.
How soon after giving birth is it safe to begin taking medication to manage anxiety and depression? And what medications are considered safe?
So I think all the SSRIs are considered safe. I think postpartum period is really, and you can tell me goes are, but I think postpartum is really when women are vulnerable to developing postpartum depression or postpartum anxiety. And I think giving birth in the middle of a pandemic, which is certainly nothing that any of us anticipated,
Right.
only adds to that. So I'll leave the rest to you to comment about that.
Sure. So I think it's really important to consider that the first few weeks are considered baby blues. So if you're feeling sad, if you're crying a lot, if you're having a hard time in the first 2 weeks, that does not mean you have postpartum depression. But if it does feel like too much, you should reach out to us so we can put a plan in place. There are plenty of reproductive psychiatrists who do prescribe medications that are safe for you if you are breastfeeding. If you're not breastfeeding, you don't necessarily need those medications. You do have more options. But if you are breastfeeding, then there are plenty of safe medications, and we can get you in touch with those reproductive psychiatrists. They're all doing telehealth, and again, they are sliding scale. So now you actually have an advantage in that respect, in that normally they're extremely expensive, and right now they are being much more generous with their time and their expertise. If you want to begin taking medication, or if you have questions about it, you should reach out to me or Perry, and we will talk you through how to make that decision. It really is individualized. If after the 2-3 weeks postpartum, if you continue to feel bad, then you should definitely reach out to me, and we should talk about putting a plan in place for your care. There are a number of things that you should be really considering. I always talk to patients about the most important 5 things. The first one is sleep. Are you getting sleep? Try to get 3 consecutive hours, ideally 2 sets of 3 consecutive hours, so that you can get some REM sleep. That is going to help you feel significantly better. So If you are supplementing with formula or bottle feeding, pumping and bottle feeding, then see if a partner or a friend or somebody who is staying with you and helping you postpartum can take over 1 or 2 feeds in the middle of the night so that you can get some rest, because you're also recovering from something really intense that just happened to your body. So whether it was surgery or whether you delivered vaginally, you have a lot of recovery to do. So you need that sleep more than anyone else. And I cannot emphasize that enough. And there are ways that your partner can act like a night nurse and help assist you in getting better sleep. So if you want to know about that, call me and we will talk about it. The next thing that is really, really important is food. If you are breastfeeding, you should be taking in 500 extra calories a day. You are probably not doing that. You're probably eating less postpartum than you would normally eat because you are overwhelmed and taking care of a baby. You need to make sure that you're eating 3 meals a day and having plenty of snacks, especially when you're breastfeeding. The next one is water. Water is very important to mood. Your blood sugar will drop if you're not eating regularly, and water will also impact your mood. So make sure you are drinking plenty of water. You also need more water if you are breastfeeding. 2 other things I always say. One is get outside. I know that's especially scary right now. If you have a balcony or somewhere to sit, I think that's okay as long as you're getting fresh air and sunlight. If you can just go outside without the baby for a walk to get some air, to get some vitamin D, I think that's really important. If you're too scared, then we talk about that. And the last one is do something for yourself every day. Postpartum, it's very easy to lose your sense of self and forget who you are because you were so busy taking care of a baby. And so at least once a day, I want your partner or your friend or whoever is helping you postpartum to take the baby away for an hour to give you time to do something that reminds you of who you were before this all happened. And I mean both the baby and COVID. So read a book, talk to somebody on the phone who makes you laugh, do something. If you love to cook, cook something. If you love to make art, do something that brings you back to who you were before all of this happened. And that's really important. So those are the 5 things I want everyone to focus on. Don't worry about it. You can always call me and I'll walk you through them in more detail.
So Gozer, I just feel like we can't stress this enough. I feel like we always get caught up in the physical part and, you know, the breasts and the vagina and the uterus and everything. It's all about the physical part. And I think that when I speak to patients postpartum, and I talk about obstetrical emergencies or things that are kind of red flags, I always talk about postpartum depression and postpartum anxiety. And you should never feel bad about calling us about this. We consider this really, really, really important as your blood pressure, as important as if you're bleeding too much, as important as if you have mastitis or you're having a breastfeeding problem, which is, people call us for that all the time. This is equally as important. So I just want to stress that to everybody.
Yeah, and you're very lucky to be at a practice that really emphasizes it and has a team in-house that is working to make sure you're okay. So reach out to me. Even if we're just chatting on the phone, we can make sure that you are getting the help you need.
And Golzar and I have had many, not many, but a few situations where we've had to talk on a Saturday or a Sunday and get a plan in place quickly for a patient who was really having something emergent and we needed to get them some help. And if it's the middle of the night or if it's Sunday afternoon, her and I can work together to make that happen.
Yeah, don't worry. I have no problem waking Dr. Lashua up. Should I have anything on hand in case my infant is exposed, like medications?
I don't think you need anything special. I mean, I think all new moms probably have a baby thermometer, which you'll need, and infant Tylenol, and I don't think you need anything more than that.
And anything outside of that, you should really ask your pediatrician.
Absolutely.
So now I have some general COVID questions and some questions. We're going to talk a little bit about anxiety.
Okay.
So what New York City ER should we go to if I or someone in my house gets sick? Do we need to worry about hospitals being overloaded?
Good question. So I want to stress that you should really only go to the hospital if you're short of breath. If you're not feeling well, if you have fever, if you have cough, if you have body aches, stay home, stay home, stay home. Do not overwhelm the hospital system with something like that. However, if you are short of breath, it's time to get yourself to an emergency room. Should you take an ambulance? Yeah, I mean, if you're that short of breath, absolutely. So I think NYU does a great job. I mean, I just think their emergency room is fantastic. I think the doctors there are top notch. However, should you go out of your way to get to NYU if you're having trouble breathing? No, then you should go to your local hospital, keeping in mind that some local hospitals are really small community hospitals. You want to go to a major medical center, but there are plenty in the Bronx, Queens, Staten Island. And if you call us, we can kind of guide you a little bit about where to go, but I would try to get to NYU if possible.
Great. What is Downtown Women's opinion on visiting parks, playgrounds, grocery stores, etc.?
So I think if you can send someone out, or if someone can drop off stuff for you, that's ideal. I think that we need to keep the social distancing. That rule has to apply even if you go to a park or you leave your house. I am also for the sunshine and fresh air having a huge effect on your mood. So I hate to discourage that, but I think it can be done in a safe way. And again, if you have a patio or something like that, that's fine. But I think going to the park and seeing the spring flowers, there's something very therapeutic about that. And I would wear a mask and I would keep the social distancing rule applied.
And it's very important that everybody understand that this has a lot to do as well with your level of anxiety. If it's going to make you feel worse every time you go outside, then maybe we need to find a way that you can get fresh air that's not going to increase your anxiety. If I'm being totally honest, I don't go outside every day. And I find ways to sit in my windowsill and get plenty of sunlight without having to go downstairs every single day. So it really is what works for you. If going outside is going to make you feel worse, then call me and we will discuss how to get sunlight and do things safely.
And just in that vein, Gulzar, if people can continue exercising a little bit, I think that's another thing that really affects mood. Should you walk 10 miles to your Downtown Women appointment? No. Can you do something, if you're too anxious to go outside, I don't see any reason why you can't do a little prenatal yoga at home, do some stretches, some light weights, some, whatever, if you have a machine at home. I think exercise is a huge mood booster, so I would encourage patients to continue doing that.
So the last question is, staying in this lane, how do I stay physically and mentally healthy throughout isolation and the pandemic? So absolutely.
We answered that.
Absolutely exercise. Also, eating right and drinking plenty of water, the things that I was talking about earlier to do postpartum, those kind of apply to everybody right now in this really crazy time. In terms of how to deal with anxiety, I want everyone to understand that there is something such as a healthy level of anxiety. There is too much anxiety that is then debilitating and you can't function throughout the day, or you're crying too much, and then we have to absolutely address. But anxiety is not in itself a bad thing. It is what keeps us safe. It's why the people who are afraid of flying and are really aware when they get on a plane are most likely to survive a plane accident, a plane crash. And it's because they're more vigilant. It's because they know where the exits are. It's because they're thinking about things. It's because when the smallest things happen, they start going into action. And that vigilance is anxiety, and it's important. And so having a healthy level of anxiety in this pandemic is so crucial to keeping you safe. It is going to help you survive it because you're going to be more vigilant. You're going to be careful about not touching your face, as Dr. Lachua has done several times on this webinar. You're going to be very careful to not touch things outside or do things that might put you in greater risk. And that is a good thing. We want you to have a healthy level of anxiety. All anxiety is not bad. Another thing is laughter. I know we all want to watch Outbreak and Contained and all of these pandemic Netflix shows, but it is not a good idea right now.
I was just watching Married with Children.
See, there's a great one.
And I said the same thing. I said, oh my God, it feels so good to laugh and not to watch CNN just for like a few minutes.
Yeah.
But yeah, that's huge.
Take a break from all the
yes,
high stress Netflix shows that you normally watch in your day-to-day life because your day-to-day life was not super stressful, and watch something that is going to bring you laughter, that is going to bring you more joy. That's really going to help right now. Or call your funniest friends. This is the time to be Zooming your most fun friends, the people who make you laugh, the people who make you happier, because that's what you need right now. Another thing I want to say is I support meditation. I think meditation is great, but for most people who are not used to meditation, meditation can be more frustrating, especially when you were starting to learn to do it. Right now might not be the time to learn to meditate.
I don't meditate. Sorry, Kozar.
We noticed. So absolutely, like if meditation works for you, Expectful is a great pregnancy postpartum app for meditation. We love it, but and I think it's pretty affordable. But if it's not good for you, there's another app that I prefer, and it's called Mindicine, Mindicine, and it is various different sound waves that correspond to different brain waves. So it's a lot more passive than meditation, it puts you into a different state. There is one for anxiety, there is one for concentration and focus, and there is one for sleep to help you stay asleep. Some patients think it's wonderful and it really works for them. I particularly do like it. Some people think it doesn't really help, but it's definitely worth trying. It's really cheap. It's like $2 or $3.99, and it's an easy passive way to really try to lower your anxiety. You do have to use headphones for it. Another thing I want to talk about is oxytocin. If you are postpartum or when you have your baby, doing skin to skin with your baby is going to elevate your mood, and it's going to help with your bond. It's a great, great thing to do, especially in times like this when you need to help elevate your mood. You can also do it with your partner. So that can mean the more fun sex, or it can mean just cuddling. But skin to skin, eye contact, holding each other, that oxytocin is going to help you both calm down, and it's going to also help you feel a little more connected to each other, which I'm sure is really hard since you've been quarantining together for weeks. Okay, so we have a few more questions that
we're expecting a big baby boom after this, because everyone's going to be releasing their oxytocin.
That or a divorce boom, I'm not sure.
We'll see.
We'll see. Okay, so I have a few more questions coming from the crowd.
Okay.
Can we go over, actually, we'll come back to that one. Can I have a doula as my birth partner instead of my husband?
Yeah, but that you can't swap her out.
So once the doula is your birth partner,
that's
the doula is your birth partner for the whole time. So that means even postpartum, you can't change to your husband.
Yes, that's right.
Great. Can birth partners stay the night? We did answer that. Yes, birth partners can stay the night.
Yes.
And that includes the doula, right?
Yes. Also, I'm just seeing the chat. I'm sorry, Gulzar. So a partner cannot leave and come back. You have to stay. You can't leave and go get food or something like that and come back. Once you're in, you have to stay in.
So does that mean they need to pack food, or will there be food available to them?
No, there's food at the hospital.
Great. Can my birth partner leave after screening into the hospital for things like food? Okay, we just answered that. Is there anything special we should bring to the delivery?
I mean, just normal, nothing special except for your masks in terms of COVID-19. That's the only thing I would recommend.
Great.
There's plenty of hand sanitizer and soap. Like, you don't have to bring your own.
Great. Are the postpartum rooms at Langone shared?
Yes.
Do you want to say anything more about that? No. Okay, we'll skip it.
They're shared. You know, there are some private rooms. Our patients often get private rooms. But yeah, I think you should be prepared in your head that you're going to be sharing it with somebody else.
Great. Should I cancel my baby nurse?
Probably. Yeah, I mean, why would you bring anyone that you come into contact with is a potential exposure. So I would say, yes, you should not have a baby nurse. I mean, if we're going to say family and friends can't come over, then it would be kind of, you know, I think a baby nurse shouldn't come, or anyone should come.
Now, I have somebody who I've been working with whose baby nurse has been quarantining herself for the past few weeks. Is that better if the baby nurse is quarantining?
You know, I don't know. We do think this is passed in an asymptomatic way. You know, and I don't know that we know how long that can be. So that would not reassure me completely, is I guess the message that I want to give.
Okay, so it is your choice, but we are skeptical.
I would discourage having anyone else that needs to be in your house.
Other than you and your partner, if you have
That's
one.
right.
Great. And do you know if baby nurses are doing any virtual support right now? Have you heard anything?
I'm sure they are. I haven't heard, but I can't imagine that they're not.
Great. So if you need to learn something from your baby nurse, you might be able to do that anyway over virtual support. Is cardio exercise okay during the second trimester?
Yes, absolutely. Go for it.
Do you think they're thinking of Peloton? Is that one okay? Let's just address
Peloton's
that.
fine. Yeah, I think you can spin when you're pregnant.
Okay.
Yeah, why not?
Or running outside.
It's fine. As long
I
as
don't know
you've
what
been
other
running.
cardio there is.
Elliptical, rowing, swimming, all those things are fine.
Okay, great. Should we quarantine after leaving the hospital?
Well, I would assume that people would be quarantining pretty much anyway, but I don't think that you need to self-quarantine in respect of, I've been exposed, I need to quarantine. I think the social isolation distancing, that rule should apply, but I don't think specifically you need to quarantine because you've left the hospital.
So if they are planning on seeing their parents or in-laws, let's say, should they be thinking that they need 14-day quarantine from the hospital before they see anybody elderly?
I don't know. That's a tough question. I mean, I honestly feel like I wouldn't see anyone elderly. I mean, I think that same rule applies. I haven't gone to see my parents. My kids haven't gone to see my parents. I mean, that social distancing rule still applies postpartum.
Great. Circumstances happening as, circumcisions are happening as planned, right?
Yes.
We
Yeah.
touched on that.
Yeah, I think we did.
Great. Because the postpartum rooms at NYU are being shared, what precautions are being taken? So remember, if somebody does test positive, they are put in a separate room. They are not being put in a shared room.
Right. So you can assume that your partner, if they were symptomatic, they would have been tested and they're negative. If anyone's symptomatic and we're awaiting a test result, they would be in an isolated room. The only thing, again, is just to bring your mask. There's hand sanitizer in every room. They're coming several times a day to disinfect the rooms. So besides a mask, I don't think there's anything else that you need to take precautions with.
And can you touch again on the reduced stay in the hospital? Because some people had a little more clarity on that.
Yep. So usually if you have a C-section, you stay for 3 days. So we've been decreasing that to 2 days. Okay. And same thing, you know, in the same vein, postpartum, usually you stay 2 days. So we've been staying 1 day. 24 hours after your postpartum or after your birth, somewhere after that, we'll send you home, but you have to stay at least 24 hours.
And can people still request private rooms?
Mm-hmm. Yeah.
Great. And let's just see, we have one more coming through. Will Downtown Women be calling me about scheduling my appointments throughout pregnancy?
I mean, the way that we schedule appointments hasn't changed. The only thing that's changed is there's basically no one in the office. When you guys come in, it will look like a ghost town. Some of that is because a lot of people are working from home. We also kind of stagger appointments a little bit so that there aren't a lot of people in the waiting room at any one time, but you would book your appointment as normal. Usually we don't call patients. I think patients call and book their appointments directly, but nothing has changed. Just call the main number, ask for appointments, and they'll take you from there.
Great. And can you recommend where to buy a mask, and what type of mask should we be wearing to our appointments or the hospital?
I think any mask is fine. I think if you can get a surgical mask, that's great. If you can, I think it's fine to wear a cloth mask or a bandana. I think that's also sufficient.
And then somebody asked earlier about what kind of blood pressure cuff to buy. Do you have any recommendations on that?
I don't. I wouldn't spend more than $30 on it.
Great. Oh, okay. And then, let's see. I'm just trying to get the last few questions in. Okay, I think this is a good question. At NYU, will the janitors and other non-medical workers be working in both the COVID hospital and also the labor and delivery hospital?
No, because they're two separate parts of the hospital. We have our own dedicated kind of cleanup team, building services, we call them. So we have our own dedicated building services people.
Great.
And now it says, will they be wearing masks? Yes, everyone will be wearing a mask that you come into contact with at NYU.
Should we be taking extra vitamins right now to build immunity?
I think an extra vitamin C doesn't hurt a body. I've been taking it. I've been giving it to my kids, a little extra vitamin C. I think it's a good thing.
Somebody asked if the private NYU rooms will be used as isolation rooms for COVID-19 moms.
Absolutely. They'll have priority.
Okay. Somebody asked if a partner can't leave and come back, how can we bring our car seat?
You should bring the car seat with you.
Great question. Thank you.
Yeah, bring the car seat with you.
Somebody wants to know a dosage on vitamin C for pregnancy.
I feel like ours that we have here are 500 milligrams. I would look at the back of the bottle and see what the serving size is. I'm thinking 500, but whatever the serving size is, I think is fine. It's not special during pregnancy. So whatever the back of the bottle says is fine.
Do women in labor have to wear a mask throughout the labor?
No. I mean, we would like you to wear a mask, but we know that, during pushing and, I don't know how many of you guys have worn masks. Actually, a lot of you have, because I've seen you in the hospital, in the office. It could be a little hard to breathe in these masks, especially the ones that we wear. It feels very different. So no, if you don't need to wear, if you feel like you cannot wear your mask, we are not going to force you to wear it. And during the second stage of labor, when you're pushing and breathing hard, you will not be forced to wear your mask. So don't worry about that.
If a pregnant patient doesn't show symptoms when arriving at the hospital, will she be tested regardless or just screened?
Just screened, not tested.
Are parking options at 560? Are there parking options at 560 for labor? Now, 560 is the address of the building you should be going to.
So there are two parking areas. There is one by the 550, 560 entrance. There's also one that's by the Kimmel Pavilion. So I would encourage you to use the one that's by the 560 entrance. There's one on the side of the hospital. If you're coming up First Avenue, NYU is on the right side of the street. So there's a garage there, and there's also one across the street on the left side. So I would use those garages.
Great. I think we could take one more, and then I will review what people may have missed in the beginning.
Okay.
I do want to say that partners are able to stay the night even if the room is shared. Is that right?
Yes, as far as I know.
Okay, I want to take one from the beginning since we...
Can I just say something, Gulzar,
Sure,
since
please.
we have a minute? I just want everyone to know that there's a lot of empathy and there's a lot of, we get it, guys, that this is really a tough time to be pregnant. No one would have ever thought that this was going to happen. We know how scared you are. We know how anxious you are, but we're really committed to doing everything that we can to get you through your pregnancy and your delivery and your postpartum safely. It's just a value that we hold very strongly, and all of us do. And we get that you're scared, but just hang in there with us, because, you know, it's kind of like a team. We're going to get through it together, and then this will pass. Right, Golzar?
Yes, it will pass. Everything always does. Okay. So, okay, if you have family watching your other children, should they quarantine? Let's talk, can we, okay.
No.
So a couple of people had questions about childcare for existing children while in labor.
You mean like if you have a nanny or something like that?
Nanny, family, yeah, anybody.
Yeah, I mean, I think,
safe?
Yeah, I mean, I kind of see it like, what is my unit? Like, my unit is me and my kids and, you know, my family and my babysitter, who also is. I didn't ask her to self-quarantine. She came back and forth on the train. She was very careful. She wore a mask. So I think having a nanny or a babysitter is safe and necessary, let's be honest.
Okay, so you don't think that somebody's partner should stay home with the kid just to not bring in an additional person?
No, I do. If it's possible if it's possible to not have an additional person come in, that's ideal. So yeah, if you can manage with you and your partner and both kids, that's fine. I think just like with the baby nurse, if you can do without the baby nurse, do without the baby nurse. If you could do without your babysitter or your nanny, then you should.
The question is specifically about during labor. When somebody goes into labor, rather than having their partner come with them, should they make their partner stay home and watch the kids so that a third person is not coming into the family? A third adult's not.
Right, but then who would the patient be with? Alone? Labor alone?
I think so. I think that's
I mean, I don't like that idea. I think it's better to have someone come in and watch your other child so that the woman can have her partner.
Okay.
Women are so sacrificial, right? Women are so awesome. It's like, I'll labor alone, just stay with the baby.
I know.
You guys rock. Seriously.
You really do. All right, I'm just going to go over a few more things. Thank you so much for joining our webinar. We're committed to your maternal well-being, not just how you're doing physically, but also how you are coping emotionally, especially during such a challenging time. We have the prenatal and postpartum support program here at Downtown Women. It's here for you throughout the course of your pregnancy and your first year postpartum. So if you're feeling anxious, overwhelmed, or you're not sure how you're feeling, you can always reach out to us. We're here to help in a variety of ways. Perry, can you share the screen of the groups and stuff again? We're actively adding new groups to accommodate our patients. I'm excited to announce that I'm adding 2 new support groups this week in addition to the ones I added last week. One is a pregnancy support group and one is a postpartum support group. These groups are virtual over Zoom. We keep them very affordable and they're available to all of our patients, so please email me directly to sign up since space is limited. We also offer virtual therapy sessions over Zoom. If you need individual sessions or referrals, I can get you to a practitioner who does virtual sessions and is working on a sliding scale. We have tons of resources right now. You ladies are incredibly important to us. We take pride in our comprehensive approach to helping you through your transition into motherhood, not only physically, but also mentally and emotionally. So remember, we are here to help you through this. The last note before we end is that we have a feedback form. It will get emailed out to all of you, but Perry, can you put it in the chats for everyone? Make sure that the chat is available to everyone. You can click on this link and fill out the feedback form. We are hoping to do another webinar if everybody enjoyed this, and so filling out the webinar will help us understand how to better serve you, and then we can get to more questions. So we will be collecting questions again. Perry's email is available on your screen. You can always reach out to her for the feedback form or to ask any follow-up questions or give any feedback. That is pthompson@downtownwomen.com. And if you haven't heard from Perry yet during your pregnancy or postpartum, you will hear from either her or me at some time soon. So we have just put into the chat the link for the feedback form. So please, everybody, fill that out and we appreciate it. Thank you so much. I think Dr. Lajoie has something she really wants to say.
No, no, I don't. I said everything I have to say.
You're
Oh, this is Dr. Suzanne Lajoie, and this is Downtown Women. Did I do well?
I don't know.
Sanjay
She wants
Gupta.
to sound like Sanjay Gupta.
Yeah, so bad. I'm sorry. Sorry, Sanjay Gupta. All right, bye,
All right,
guys.
thank you so much, everyone.
Bye. Be well.